So are we learning lessons? I think only partially and dangerously slowly. But let's go back to WannaCry, right? 2017. It hit over a third of NHS trusts and it led to about 20,000 cancelled appointments. The attack against WannaCry and many others like it exploited known vulnerabilities for which patches have been available, but the NHS trust hadn't rolled it out. That should have been the turning point, shouldn't it? And yet here we are in 2025, and we've got many of the same structural weaknesses. And what happened after WannaCry was good, right? I say good, it depends on how you look at it. The government committed about 150 million over 3 years to improve NHS cyber resilience. Good. So cyber resilience, that is absolutely, I fundamentally believe, where every organization should be. That is a genuine cybersecurity, like hand on heart want, because we know we're not going to prevent, right? We all agree with that. So let's build a response capability that withstands the storm. So this 150 million sounds impressive, but let's break that down. That's about 1.5 million per year per trust. And most of it was actually spent on central services and assessments, if you look at the facts and figures, not directional operational upgrades. We're not running quickly enough. The consequences are real. And here's one story that really is personal to me. In 2022, there was a ransomware attack on the third-party provider behind NHS 111. And that disrupted emergency care across England. I was working in Southeast Coast Ambulance at the time, in an ambulance on the front line. I'm a paramedic in my spare time. And we had to go back to open radio calls for dispatch and updates to patients. And I want to give people some example of just how important tech is. When an ambulance gets dispatched to a job, we have your medical history up on our mobile data technology system. So I can see your doctor's history, the patient history. So before I get to you, I kind of know what I've got to do and what we're dealing with. Obviously, things change when you meet the patient. We had none of that for that entire blackout. Confusion between which crews were dispatched where, and actually ultimately led to some really serious outcomes for some patients. I was on the front lines when that occurred, and it wasn't the first time, and I don't think it will be the last. So the outcome of that was the government released strategy documents, and it talks about building cyber maturity, improving resilience, establishing a unified framework. But strategies don't stop at ransomware, right? Implementation does. And implementation is still left to individual trusts, many of which lack funding, staff, and in-house cyber capability. The UK's healthcare sector is still one of the most attacked sectors in the country. And 80% of those attacks, again, according to the NCSC, are linked to phishing or credential compromise. So we know how the attackers are getting in. We know what they're targeting. It's not a mystery to us. So why are we closing the gaps? We need to treat these things as clinical issues, because that's when we take it far more seriously at a healthcare level than just IT issues.